On to other news tonight and to the coronavirus, and news this evening that the dangerous South African variant has now been detected in a patient here in New York City at a hospital here, brought in from Connecticut. This particular variant has now been seen in at least 8 states, and Dr. Anthony Fauci tonight warning of reinfection with this South African strain, meaning some people have had the virus and are now getting it again. And all of this as scientists now study 7 other variants that have been found in the U.S. And as more states open up eligibility for vaccine, that's good news for people hoping to get a shot. The issue has become the lack of supply in so many states. More than 38,292,000 Americans with at least one shot now. That's nearly 12% of the population. And here's ABC's Eva Pilgrim tonight.
Tonight, the South African COVID variant spreading in the U.S. One case now confirmed in a patient from Connecticut, now hospitalized in New York City.
We have no evidence of any spread in New York State today.
The more contagious South African variant appears to chip away at the effectiveness of the vaccines. It's now identified in 8 states. Dr. Anthony Fauci warning there have also been cases of reinfection with that South African strain.
In South Africa, there were people who got infected with the original virus, recovered, and then got reinfected with this new variant, the South African variant, which tells us that prior infection does not protect you against reinfection, at least with this particular variant.
Across the country, COVID cases are down by 62% in the last month, but variants threaten to reverse that trend. British scientists say the UK variant, now in 41 states, is likely more deadly. And researchers are now tracking 7 new strains originating here in the U.S. to see if they're more contagious.
We're nowhere out of the woods. If we relax these mitigation strategies with increasing transmissible variants out there, we could be in a much more difficult spot.
And now a surge in demand for the vaccine. Across the country, states widening eligibility. In New York, 3 million more people with underlying health conditions are now eligible. But the challenge is getting an appointment. 26-year-old Kenesha McFadden has a heart and autoimmune condition.
I woke up every hour on the hour, refreshing any website that I could find. It was very anxiety-inducing. I was exhausted by the time I had actually booked my appointment.
It comes as New York's Governor Andrew Cuomo is addressing his handling of the numbers of coronavirus deaths in nursing homes after his office conceded that it delayed turning them over to state lawmakers.
The void we created allowed disinformation, and that created more anxieties for the families of loved ones.
Families have wondered whether their loved ones could have been saved. Today, Cuomo defending his record.
The truth is everybody did everything they could.
Tonight, renewed concern for young patients. Some hospitals reporting an increase in cases of that rare multi-inflammatory syndrome in children, MIS-C. In Indiana, the parents of 5-year-old Janiyah Johnson say it happened so fast when she got sick with COVID, vomiting with a fever, her kidneys and liver then failing.
The doctors told us maybe if we would have waited one more day, they possibly couldn't have done anything for her.
Doctors successfully treated Janiyah with medication.
Tell us you feel better.
I feel better.
That is good news. We need some reassuring news on this virus. Eva with us now from the pharmacy giving out vaccines. And Eva, what you reported there, the South African variant now confirmed in that patient in New York City. There are 7 newly identified variants originating here in the U.S. that they're looking at. And authorities are saying, even though cases are coming down, now's not the time to let your guard down.
That's exactly right, David. Health experts are urging people to mask, double mask when possible, social distance, wash your hands, all those things more important now than ever. And they're reminding people, even if you've gotten the vaccine, you still need to keep practicing those measures. David?
Yeah, because those vaccines could then be tested by these variants. Eva Pilgrim with us every step of the way on this. Eva, thank you.
Hi, everyone. George Stephanopoulos.
Square Terminal makes payments fast and easy. With no hidden fees or long-term contracts, you can stop settling and start expecting more.
The big picture COVID outlook here in the United States is improving, but there do remain some big worries, including the spread of several new coronavirus mutations. And the Biden plan to get children back into classrooms ASAP is off to might say a bumpy start. Let's go through some of the numbers. And again, the numbers at the moment are encouraging from a horrible place, but moving in the right direction. You see 39 states in green. 39 states reporting fewer new COVID infections now compared to a week ago. That's the direction you want to be heading. 8 states holding steady, only 3, South Dakota, Nebraska, and Alaska, reporting more new infections now compared to a week ago. If you look up here are the two graphs that matter. You see how much this is down. Might be hard to see all the numbers, but 64,938 new COVID infections reported on yesterday. That's the lowest number since back in October. You see some days up around 300,000, moving down below 100,000. If it can stay there, sometimes the weekends are low and it pops back up. But you see the trend line heading down. That's where you want to keep it. Cases are down, hospitalizations as well. 67,000 Americans in the hospital on Sunday. Remember the peak was about twice that. It was a little over 130,000. So this is coming down too. First time we're below 70,000 since back in the middle of November. That is encouraging. Again, you're coming down from a horrific spot, but at least you're coming down. Here's one of the worries right now. We've talked about the UK variant, the South African variant. Well, there are 7 variants believed to be homegrown here in the United States. They're giving them bird names. Robin 1 in 30 states, predominantly the Midwest. Robin 2 in 20 states, predominantly in the Southeast. And then there's a pelican variant that's been discovered in 13 states, plus in Australia, Denmark, Switzerland, and India. Again, as the virus mutates, that concerns doctors, which is why they want to shove the case count down and get vaccines in people's arms. That progress is being made. When Biden became president, just shy of 900,000 vaccinations a day, on average. Now, they're up to 1.6 million vaccinations a day on average, trying to push that number up. And as you get more supply, one of the concerns is how do we get teachers back into schools teaching kids? Well, teachers say vaccines would help. 28 states now, plus the District of Columbia, have made it eligible for at least some of their teachers to get a vaccine. 28 states plus the District of Columbia. It's not universal, but in those jurisdictions, at least some teachers can get a vaccine. The new head of the CDC says this would be great, getting teachers vaccinated, but listen here. He says it is not priority 1 for reopening schools.
We really need to do the hard work to make sure that there's universal masking, there's strict 6 feet of distancing between, that there's cohorting or potting so that there's restriction of disease if it were to be transmitted. I'm a strong advocate of teachers receiving their vaccinations, but we don't believe it's a prerequisite for schools to reopen.
With us to share her expertise and insights on this very important subject, Annette Anderson, who's the Deputy Director of the Johns Hopkins Center for Safe and Healthy Schools. Thank you so much for your time today. This is the dominant issue around the country. I know you are grateful that you see more federal engagement on this question. There have also been some concerns about whether the White House and the CDC have been on the same page about the pace of reopening schools. What do you see as the pluses and any minuses so far in the new Biden approach?
Well, first of all, John, thank you again for having me. I think that there are lots of reasons to be optimistic that we are trending in the right direction, to see that the federal government has finally decided to jump into the fray around all of the chaos on school reopening. It's a signal, it's a bellwether that suggests that we can get this done in a timely fashion. I know that everyone thought that maybe we would get this done in the first 100 days, but I think that there's a longer-term plan. And so one of the things that I've said is that we've got to have a czar, a school reopening czar that's going to help us to organize this. Because as you just mentioned, there are lots of pluses to having the federal government be part of this, but part of the challenge is the bureaucracy that has to be waded through in order to make this happen. So I do think that we're going to need to have all hands on deck, but there has to be a place where the buck stops in order to coordinate this well.
And so let's go through the new CDC guidelines and tell me what you find most significant, and if anything, and there's most significant in terms of a change right there. Universal and correct wearing of masks. You heard Dr. Walensky talking about that too. Physical distancing, washing hands is critical, cleaning facilities and improving ventilation, and then contact tracing, isolation and quarantine. When you do have cases, one of the, as you know, you have a federal conversation, but then you have thousands of school districts across the country with different challenges. In rural America, the challenges are going to be very different than they're going to be in an inner city where you may have older buildings and it's a ventilation question there.
Yes, the ventilation question, it does hang in the balance about whether or not we are really prepared to fully reopen our schools. I mean, we know that the Biden administration is pledging $1.9 trillion. That seems like an enormous sum of money, but so much of that is already pledged to things like keeping and retaining our current teachers and trying to meet school budgets across the country. And there is some funding for PPE, for example, but we've got to make a concerted effort around this ventilation issue. We've got to make sure, because there are classrooms that don't have windows, and we need to think about the size of those classrooms in terms of social distancing, we know that the landscape of public education has changed permanently forever because of the pandemic, but we now have an opportunity because of this to rethink how we want to respond and to think about some new innovations and how we want to move forward with this. So, the ventilation question is a significant one, and I do think that the Biden administration will need to have some additional resources available for districts and schools. But what is encouraging is that, we've had 14,000 districts with 14,000 plans, and now, because we have the federal government involved, and they're talking about collecting this data on the transmission rates and the positivity cases, it will be critical for people to start seeing that data, because part of the real key issue right here is that we've got to rebuild the trust among so many families and among educators as well, John, because those families want to believe that we have a great way to get all of our kids back to school.
And again, you mentioned rebuilding trust, but so many of these decisions, you can have federal guidelines, and you have so many different school districts that have to implement them. We know so far from existing research, we can show our viewers out there, schools that strictly following precautions had the same or lower infection risk in their community. So if you have a school and you have masking, you have distancing, the kids are not at higher risk, but that's been proven. Middle and high school students are more likely than younger students to catch or transmit COVID, and close contact in indoor sports, activities that involve shouting or singing, significantly raise the risk. From what we know so far, how do you take, after we're a year into this now, how do you take what you know and apply it and then say, okay, we can do this, but we must not do that?
Well, that's where I think having this color-coded system will be very integral to helping to build back the trust amongst families in particular. What we do know is that where schools have provided some seats for in-person learning, that many of our most vulnerable students have not come back yet. And so that's a significant concern. So we will not feel like this process to reopen our schools is successful until we have reached those families and convinced them that schools are safe to reopen. So part of what we have to now do is to figure out how we get those families back. Those families have already said that they are concerned. In many of our urban districts, they've been already concerned about having an economic pandemic on top of the global health pandemic, on top of a racism pandemic, and now you've added an educational decision-making pandemic. So parents want to be able to trust that the districts and the federal government and the states are all aligned with the information that they're giving to everyone, so that there's consistent, transparent decision-making, so that they can be comfortable about buying back into what we're offering in public education.